Hi, I'm Dr. David Stoker, board-certified plastic surgeon in Los Angeles, and today I'd like to spend a few minutes talking to you about what is the ideal breast implant size. This, for instance, is a silicone gel implant size 285 cc's. That doesn't mean a lot to the average consumer out there who's considering breast implants. When we're thinking about the type of implant size, there are other key considerations. Number one, what is the volume of the implant? So, for instance, this is a very large implant here, close to 550 cc range. This is a slightly smaller than average implant at 285 cc's. And this is a baby implant here, which is a 175. You can imagine how differently this would fit on somebody as opposed to this implant here. So these are very different sizes. The volume is going to determine what cup size the patient increases to. If we want to increase from a 34A cup to a 34B cup, that's going to be an implant in the mid 200 cc range. If you want to go from a 34A cup to a 34C cup, that's likely going to be an increase in somewhere in the mid 300 range. If you're a very large patient, for instance, I once operated on a transgender person going from male to female, and this person was 6'5". To increase two cup sizes, it took almost a 600 cc implant because the chest wall was so large. So it's key to understand what is the size of the body when you're deciding what volume of implant is going to achieve a certain cup size difference. The next thing we want to think about after volume are what are the proportions or the profile of the implant. Some implants are narrower and project out more. Others implants are wider and flatter. There are different reasons to choose each. Let me give you some examples. This is a relatively lower profile implant. It's broad and relatively flat. In comparison, this is a high profile implant. It projects out quite a bit and isn't that wide. What are the reasons why you would use a lower profile implant versus a higher profile implant? A patient who had a relatively small body but wanted a very big implant, it's a wide implant simply is not going to fit on that body. It would extend out into the armpit and not look very proportional. It wouldn't be centered behind the nipple. That's when I would consider switching over to a higher profile implant. A higher profile implant will still fit with a certain base size on a smaller patient, but will allow them to add that volume as projection. If you were to take a larger person and put a smaller implant on them, you wouldn't want a high profile implant. That would float around the chest wall. It would look almost like a baseball sitting on the chest. It wouldn't be proportional. So that's kind of a key consideration deciding between a lower profile and a high profile implant. And of course, the most common type of implant is somewhere in between, either moderate or moderate profile implant, because most people are not at one extreme or the other. Another thing that we're going to consider in choosing the right volume of implant is the overall shape. Some people might consider, for instance, going with a teardrop implant versus a round implant. These days, because of their concerns about textured implants and how certain complications are being caused by them, for the most part, we're using almost exclusively smooth implants. And smooth implants can rotate freely within the body. So while we're using smooth implants, we don't typically want to use an anatomical-shaped implant, such as a teardrop-shaped implant. Those implants could spin and look very strange. That is a detailed explanation of how to choose a size for a breast implant case.